The use of blood and blood transfusions is not uncommon in the medical field. The first known blood transfusion was done in 1628, and the first blood transfusion in a human was completed in 1818 by British obstetrician James Blundell. Approximately 5 million people each year need blood transfusions for some form, be it due to surgery, trauma, or illness. The use of blood transfusions is both a life-saving and life-sustaining medical intervention. Being a medical professional, the need to educate patients on the pros and cons of every intervention, including blood transfusions, is of grave importance. The use of blood transfusions can be needed for many different reasons, as well as different types of blood components to be transfused. Both blood transfusions can be whole blood, that includes all the components of the blood that is in our bodies, or just certain parts of the blood. The type of blood used depends on the circumstance. Many patients need blood transfusions during surgery to replace blood lost at that time. It is common for patients with anemia to receive transfusions of red blood cells, whereas those suffering from hemophilia are in need of platelets and clotting factors. The process of blood transfusions are very complex. Before a patient is to receive a blood transfusion, they first must have their blood tested. This involves a finger poke or a blood draw, where blood is typed and cross-matched to the patient's exact blood type and antibodies, if there are any present. The blood is then transfused into the patient via an IV or intravenous line, either in the arm or, in some cases, like in heart transplants and other heart surgeries, a central line inserted into the main veins of the neck. A blood transfusion can take anywhere from 1 to 4 hours, and it depends on the type of blood component being transfused. While a patient is receiving blood, they are closely monitored by highly trained medical professionals, usually in this case, a nurse. During the first 15 minutes of any blood transfusion, a patient is closely monitored. Their vital signs, and as well as the infusion site, either in the arm or neck, is closely watched for any signs of reaction. After these 15 minutes, hospital policies are followed in regards to how often a patient is checked and monitored until a blood transfusion is completed. The use of blood transfusions is very common in the hospital setting, but it also can occur sometimes in the home setting as well for very sick individuals. Highly trained medical professionals are able to give blood transfusions in the home. Blood transfusions are a life-saving intervention used by medical professionals during surgery and trauma. Patients who undergo major surgeries are at risk of blood loss. Losing too much blood at one time can cause the body to shut down. Transplant surgeries often require a great deal of blood transfusions. About 1/3 of every heart surgery patient requires a blood transfusion. Without these blood transfusions, they would surely lose their lives. Individuals involved in traumatic events like car accidents or gunshot afflictions also receive many units of blood during emergency surgeries. I have seen in my OR experience one patient received 10 units of blood during an emergency surgery for a gunshot he was afflicted with. Patients can also receive blood transfusions due to illness. Patients who suffer from different types of anemia often need blood transfusions. Aplastic anemia, iron deficiency anemia, and sickle cell anemia are just a few common types seen. Patients who suffer from these illnesses either have a deficiency or an abnormality in the blood component that requires the need for replacement. Without these transfusions, these patients can become gravely ill or even die. Another common illness that requires the use of blood transfusions is hemophilia, or thrombocytopenia. This is a condition of the platelets and clotting factors of the blood. This means that these patients have an issue with bleeding where the blood does not clot correctly as it should. These patients are at risk for bleeding from minor bumps and scrapes. By receiving transfusions of platelets and clotting factors, these patients are able to live almost normal lives. While blood transfusions are generally safe and beneficial, issues can still arise. The most common issue that occurs is transfusion reactions. These reactions can range from mild to severe. Even with every safety measure followed, patients can still have an allergic reaction to blood products during transfusion. When this occurs, the transfusion is immediately stopped and the patient is reevaluated before these transfusions are reinstated. Patients who undergo transfusions often are also at the risk of developing iron overload. Iron overload can cause many issues and also damage to the liver and the heart, as well as other organs in the body. Patients who could possibly require blood transfusions are often afraid of the risk of having serious infections transmitted to them through the blood they receive. Infections like the human immunodeficiency virus, or HIV, hepatitis B and C, and rarely variant Creutzfeldt-Jakob disease, which is also known as the human version of mad cow, can be passed on to patients during these blood transfusions. Though not a con per se, some patients are against receiving blood transfusions due to religious reasons. Those individuals who practice the Jehovah's Witness faith are against blood transfusions. This is their right to be able to deny receiving blood transfusions, and we as healthcare professionals have to respect their wishes. I have, however, seen in some instances these individuals accept blood transfusions, but it is very rare and the conditions are usually very dire. Blood transfusions are a commonly used medical intervention during surgery or treatment for illness, in the hospital settings and in the home in some cases. Highly trained medical professionals are often utilized in the administration of blood transfusions as well as their preparation. The use of blood transfusions can be both life-saving and life-sustaining. While the risks of transfusion reactions and disease transmission are real, these diseases are indeed very scary and serious. However, every precaution is taken to ensure that these blood products used for transfusion are safe and rigorously tested. The need for a blood transfusion should not be withheld due to the concerns of reactions or transmission of illness. These situations do not commonly arise, and most of the time, many blood transfusions are completed without any issue, and the patients have no adverse effects. While there is not any current man-made alternatives to human blood, we do have medications that can mimic the actions of blood components. Some patients also, if they have the option, are able to utilize their own blood for transfusion purposes. During surgery, a patient can utilize an intervention called Cell Saver. This intervention takes the patient's blood and filters it, and then reintroduces it back into the patient's body. The benefits of blood transfusions outweigh the risks more often than not. it is important to educate both patients and their families on the pros as well as the cons of blood transfusions to ensure that educated decisions are made in the care of these individuals and their loved ones. Too many people lose their lives because they are unaware of the options available to them. I urge everyone to be informed in all aspects of your health and well-being. Educate yourself and ask questions to your medical providers. That's what we're here for, to help you. Inform yourself on the importance of blood transfusions and your options available to you, as well as the risks that are involved. The use of blood transfusions is an amazing tool that we as medical professionals have in our tool belt. It is used every day, and it saves lives every day. Thank you.